Hi, I'm Dr. John Young, Director of Medicine here at Foundational Health Center here in Largo, Florida. We are all trained as doctors. I'm an MD, DOs, we're all trained in really a pharmaceutical-based medicine. In other words, we are trained to find out what drugs we have out there to treat chronic diseases, acute conditions, things like that. And we really wait for the pharmaceutical companies to come up with another drug that we can try to treat some of these conditions. Over the years, I've used that. I've developed my ability to really use those drugs. But what has always bothered me is this: for the chronic diseases like hypertension, diabetes, autoimmune diseases, and even a lot of diseases that we have no cure for, we're still throwing pharmaceuticals at them, but are we really making that much difference? And so what we've done, we have a research arm here at our center that has really specialized more in biochemical medicine. And that's another branch of medicine, which a lot of people really don't hear much of. But in that biochemical medicine, what we've done is we've said, okay, trying to be as scientific as possible, what is the problem, and what are the avenues, not just the pharmaceutical avenues, but what are all the avenues of medicine that we can use to try to either reverse the disease, slow it down, or dare someone say, cure the disease. And a good example is this. I had a woman with severe deafness. And she's seen all the experts. It's nothing to do. It's a nerve problem. It's a problem in the cochlea, where the hair cells are worn away. The hair cells in the cochlea are attached to nerves. And so when you speak, the frequencies vibrate the hair cells, which then work on the nerves, and you can hear. And you can give them hearing aids, try to make it louder, but it's just a slow process that they're going to eventually become totally deaf. Our division has started looking at that biochemically. And what we have found is that pharmaceutically, there's nothing to do. Biochemically, there may be things to do. So she became part of our study, and we looked at trying to fix the problem in the cochlea. And we looked at a lot of different things biochemically. We came up with several things. We tried one, and 3 weeks later, she has no more hearing aids, and she hears perfectly. Because we used a different medical model in trying to get people better instead of just the pharmaceutical. And as one person said, well, John, I'm going to talk to my doctor. He's head of the department of neurology or audiology at the big hospital or at the university. And he told me there's nothing you can do. And that may be true if you're following a pharmaceutical model. It may not be true if you're following a biochemical model. Parkinson's disease with Lewy bodies dementia. Terrible diagnosis, because when they diagnose Lewy bodies, the dementia is permanent and you have about 15 to 18 months of life left. There is no cure. We give them drugs to kind of help with movement. It slows the process, but they're losing dopamine producing cells in the brain day after day after day. So we looked at it biochemically, and we looked at those Lewy bodies, and we found that there may be a way to get rid of them. We tried some treatments, and one of them, we actually got rid of the Lewy bodies in his brain, Lewy bodies dementia, and he became completely normal. Now, if you go to the heads of departments or your neurologist, he's going to tell you it's impossible. And he's right. Pharmaceutically, that was impossible. But biochemically, because we even did the scans before and after, and he is as normal as you and I, because we found a way to get rid of those Lewy bodies, and he changed and came back completely normal in his mentation. So, just an encouragement to people out there. If you don't get better pharmaceutically, you may want to talk to a doctor that specializes in biochemical medicine. You may be surprised.